Endometrial cancer, one of the most common of the female reproductive organs. It's a cancer in the lining of the uterus and mainly affects postmenopausal women. And today, Dr. Michael Robinson, gynecologic oncologist with Novant Health Zimmer Cancer Institute, has joined us to talk more about new cancer treatment. So thank you so much for coming in. We appreciate it. Now, most people associate cancer treatment with chemotherapy, radiation, but today we're talking about immunotherapy. And how does that work?
So traditionally, cancer has been treated with a combination of surgery, radiation, and chemotherapy. These are all very effective treatments, but cancer cells find ways to avoid these as well so that they're less effective in the future. Immunotherapy is a newer treatment type that has emerged over the past several years. The origins really go back to the late 1800s with the discovery that our body's immune systems are actually able to fight cancer much the way we fight a cold, the flu, COVID. But more specifically in 2018, physicians won a Nobel Prize for a specific type of immunotherapy treatment that involves giving medication through the veins, much like chemotherapy, to ramp up the immune system and help it to fight tumors that way, as opposed to targeting cancer cells directly like the chemotherapy does.
And chemotherapy, radiation, they take a toll on your body as well. Do you add immunotherapy to that, or is it a sole treatment?
So they absolutely do take a toll on their body. Side effects are significant with chemotherapy and radiation. Immunotherapy is not without its side effects as well. It can be used by itself, specifically in uterine cancers and gynecologic cancers. There are studies that have shown that it's less effective when used by itself, and that when you use it with traditional chemotherapy, these chemotherapy drugs are thought to actually sensitize the tumor cells to the immunotherapy, which produces what we call a synergistic effect, meaning that it is more effective using the combination as opposed to using either type alone.
And there's actually a study going on right now studying immunotherapy.
We do, yeah. At Novant Health New Hanover Regional Medical Center, we have a trial with advanced endometrial cancers, meaning cancers that have either spread at the time they're diagnosed, or people have been treated before and the cancers have come back. And this involves a combination of two different chemotherapy medications, and patients are either given an immunotherapy drug or a placebo drug.
And can folks still sign up for the trial, or is it already underway?
The trial is closed to enrollment, so we're in the investigational stage right now.
All right, so we'll hope to hear the results maybe sometime soon.
So yes, well, we do have results from a 12-month analysis that have shown that there's actually been up to a 70% reduction in the progression of the cancer or death in patients. So yeah, very promising.
All right, thank you so much for coming in to join us. I appreciate it.
Thank you.